Hi everyone, these are the important questions. Do I need to go for chemotherapy? How many sessions of chemotherapy do I need? What about immunotherapy? What about surgery? What about CT scans? Well, join us on our Simply Healed program every Thursday nights at 7:30 p.m. Singapore, Hong Kong and Philippine time. Our sessions are interactive, featuring a live Q&A with experts and doctors who will answer your questions in real time. You can type in your questions and get immediate, personalized responses. This is your chance to take control of your health. So take advantage of this informative and supportive experience. Visit our Facebook page and message us on Messenger to find out more. See you there this Thursday.
One reason why I recommended initially PPARS is because it can induce lung cancer cell death. The main reason why I tried PPARS liquid, and it did well for the patient. It helped with the tumors. The enlarged abdominopelvic lymph nodes were not detected. This was gone. So that was something that I was actually quite surprised. A 12-centimeter tumor disappearing.
Everybody turn to your neighbor and say, do more. Right? Don't just think there is no one product that will cure you of cancer. Okay, that is like it's like a scammer trying to sell you something. All right, it is a comprehensive approach. When you need surgery, do the surgery. But prepare for the surgery so that you recover well, right? And then if you need to do chemotherapy, radiation therapy, do it. So this is where PPARS really comes in. It's a gene activator, so it's a signaling pathway. It switches on your pathways, your systems. Then the other nourishment that you take will be properly used. Is it easy to understand now?
Now let's not keep you waiting. We are now officially opening the AMA or Ask Me Anything portion.
So she has to take maybe just the capsule or the powder just to regulate blood sugar. And then undergo the surgery, and after the surgery, to aid in wound healing also and for recovery, she can continue the capsule.
I can safely say this, all LJ products are great. But if you have acute illnesses like cancer, then we are a world of a difference. Because if you want chlorella, take chlorella. If you want spirulina, take spirulina. When you take Simply Nature PPARS, you're taking our microalgae for its PPAR agonist.
We are always with you from start to finish.
Yung sister ko had the symptoms of diabetes. Siguro 10 years na. Madalas siyang umiihi, tapos laging pagod, pumayat, mataas ang BP. Tapos siyempre, mga non-healing wound.
Yung sa paa po ni ma'am, paano po yun nag-start?
Okay. Kasi ganito yun eh. Yung first na hospital niya, not because of diabetes. Ang una niya, pneumonia. Ayan. Doon nalaman na may diabetes din siya, by accident. Right foot niya, may para siyang matang isda lang. Yung maliit na itim lang. Tapos napapaligiran lang siya ng parang dilaw na kulay na dilaw. Ring sa sugat na yun sa center. Tapos tinanong ko, bakit? Hindi niya daw alam anong reason. So sigurado ko dahil nga may background ako sa medical, siguro dahil yun ay lumala na yung taas ng sugar niya, hindi niya na monitor, hindi niya nabibigyan ng gamot, nagkaroon siguro siya ng komplikasyon. Yung nerve sa paa na damage na, So, hindi niya na nararamdaman na may natapakan pala siya. So, probably, yun siguro yung nangyari. May natapakan siya, nasugat yung paa niya, maliit lang, tapos hindi niya naramdaman. Lumala. So, nagkaroon siya ng lagnat on and off, nakahiga lang siya. So, sabi ko sa kanya, so anong plano mo? Sabi ko, pa-check na natin yan. So, pina-check namin as OPD. Chinek, binigyan, niresetahan ng gamot. Tapos, tinignan yung sugat, binusbos. Pero kapiranggot lang ang tinignan. Tapos, in-advise na lang kami, linis, at 7 days na gamutan ng antibiotic. After ng 7 days, lumala lalo. Yung pinaka-pamamaga niya, lumaki lalo. So, sabi ko, ay, na-infect na to. Nilala ko sa emergency room. Ayun, doon nalaman lahat. Mababa pala hemoglobin, mataas masyado yung sugar, yung diabetes niya, talagang marami ng komplikasyon.
Ano po yung plans ng doktor niya?
Na-refer siya sa ortho. Ang plano sa kanya ay putulin. VKA or the below the knee amputation. Hesitant din kami pumirma ng consent. Then later on, ni-refer naman siya sa plastic surgeon. Nagsabi naman sa amin na maganda pa circulation. Might as well na tulungan na lang natin yung paa, linisin, wound dressing for twice a day, then debridement as needed, religiously. So, yun ginawa namin. Twice a day kami naglilinis, tulungan kami ng husband niya. Hanggang ang nangyari, gumanda, pero andun pa rin yung plan na putulin. Hanggang makita na gumaganda na, ayun, hindi na naulit yung plan nila na maputol yung paa.
Kasabay po ba nun may mga tinitake pa siyang gamot?
Bukod doon sa antibiotics, bukod sa mga gamot na binigay ng doktor sa ospital, may tinake din siya na alternative medicine, yung PPARS. May kamahalan. So, sinugal ko para, kasi kailangan kung di mo isusugal yun, baka maputulan talaga. Kasi kahit naglilinis kami ng paa, tapos nagdidibri, pero parang slow yung healing process niya. So, I tried na painumin siya at 10 tablets at AM and 10 at lunch and then 10 at the evening. And the soft gel, twice a day also. So, religiously binibigay ko yun sa kanya. Dati kasi dahil nag-peak yung WBC niya, medyo nag-septic siya. Sa mga nakakaalam, sabihin yung infection kumalat na sa buong katawan. Kaya nagkaroon ng problema yung kaisipan na nawala sa wisyo. Dramatically, yun yung maganda doon. Dramatically, after 1 to 2 days, parang nakita ko siya ng improvement. Doon, nakita namin na sa help ng antibiotic and together with PPARS, sabi ko, maganda yung kinalabasan. So, why not continue? Hanggang nakita ko rin na gumaganda yung healing process. Tapos yung WBC, nag-dramatically from 46. Imagine, 46, dramatically bumaba siya ng 39, 33, 27, 19, 15, and then 11, 9, 7. So, nakikita mo talaga yung changes na nagawa ng gamot na yun. So, yung support ng family ay mahalaga sa recover ng pasyente. So, una, yun yung talaga nakikita ko, yung support system. Then secondly, syempre, with the help of the advanced technology, like yung mga ini-introduce ng mga gamot, hindi ko pwedeng alisin yun sa scene, sa scenario. So, ako kasi, dahil nga nasa medical field ako, medyo alam ko yung mga ganyang mga alternative medicine and evidence-based ako. So, sa PPARS, sabi ko nga, maganda yung result. Ito walang harong biro to. It's not joke. Yung man ako binayaran So, it's no joke. Talagang maganda yung yung nangyari sa kapatid ko, lalo na yung wound healing. Yun yung nakikita ko yung wound healing talaga. Nag-granulate siya, gumanda yung circulation, nabuo ng laman, okay? Nagkalaman yung mga paa niya na dating wala. Makikita niyo naman sa picture, di ba? dating wala, nagkaroon ng laman. So, na-prevent natin yung pagputol. I can say na effective. Okay, effective yung PPARS.
Ano yung ma-advise nyo sa mga patients na same case sa sister ninyo?
Okay. So, I advise them to try. Then, kagaya ko, gusto ko may ebidensya na experience ng on hand ng ate ko. So, ganun din yung papayo ko. Try to experience yung healing, try to take the medicine religiously ha. Despite medyo may konting kamahalan, but then kung titignan mo naman yung long term na gamutan, mas mahal yun. Tsaka hospitalization. At yung syempre, yung recovery. Yun yung maganda doon eh. Yung recovery, mapabilis. So, try ninyo. Hello, I'm Joel Elcano. My sister, diabetic since way back 10 years up to now. Because of Simply Nature, hindi niya na kailangan mag-amputate. Yung recovery niya, yung unti-unti nagkaroon ng maganda, nagkalaman yung kanyang mga paa. Still recovering, yet nakikita ko yung magandang bunga. And that is because of Simply Nature, PPARS. And I trust Simply Nature.
Assalamualaikum warahmatullahi wabarakatuh. Bismillahirrahmanirrahim. Ako si Haji Norma Yusuf, taga Zamboanga City. Pero dito na ako nakatira sa Maynila. 13 pieces na bukol, pero yung mga iba maliit siya. Pero yung itong isa malaki siya, parang umabot na ata ng 3. Kaya nga ito sabi ng doktor, kailangan tanggalin na. May kaibigan ako, i-try ko daw itong yung PPARS. Pangalawang gabi, ninaramdaman ako parang iba. Yung parang may langgam na parang gumagalaw ganyan hanggang dito, hanggang sa talampakan, ganon. Pangatlong araw ko. Parang kung sumakit yung dito ko, parang gusto ko talaga. Pag ko ganyan sa CR, yun parang lumabas talaga na ganyan, napakarami talaga. Siguro sunod-sunod yun, 3 araw, ganun. Tapos sabi ko, pagtapos yung dito ko, minsan yung parang, ganun-ganun ako. Parang masikip dito, parang minsan sumasakit dito ko, ganyan. Yung na ako dito, umabot na ng mga 5 days, ganyan. Parang nawala yung sakit dito, nawala siya. Parang hindi na ako ganun-ganon. Pag nagsalita ako, parang tuloy-tuloy na, wala na akong halos maramdaman. Kaya siguro, hindi ako, sabi ko, parang ayaw ko magpa-opera, siguro mayroon talagang gamot para dito. Binigay ng God. Ngayon, hanggang ngayon, parang maganda ang maganda ang pakiramdam ko. Yung high blood ko, pag ko, parang magandang tinanggal ko na yung sa cholesterol ko, hindi na ako, pero yung sa cholesterol ko, pag tinatanggal ko yon, parang hindi, mga 2 araw, parang masama ang pakiramdam ko. Pero ito, 14 days na, ngayon 14 days na, basta 2 weeks na, hindi ako uminom ng subastatin, wala akong nararamdaman na parang maganda ang Kaya yun, ngayon bumili pa ako ulit ng tablet. Oo. Kasi sabi ko para para lumakas talaga sa akin ng Kasi nararamdaman ko talaga na maganda. At Norma Yusuf, ay bukol ako dito sa liig ko, 13 piraso. Umabot na ng 3 cm. Take ako ng PPARS 2 times, morning at saka gabi. Pag numulok ako, hindi ko na siya mararamdaman. At saka kinakapa ko siya, parang nawawala, parang wala na, hindi ko mahawakan. Hindi katulad ng dati. Salamat, Simply Nature.
Hi, everybody. Welcome to another episode of Simply Healed webinar. I'm Sheila, your host. We are an international distributor of food supplements made from a unique strain of high-grade microalgae called PPARS, which has been tried, tested, and certified to support not only cancer treatment, but also general health and metabolic syndromes like hypertension, diabetes, and high cholesterol. I'm so glad that you are joining us tonight because this topic could literally change how you think about diabetes forever. Now, you might be thinking, wait, cancer? I thought diabetes was just about sugar levels. But here's the truth. Diabetes is not just about sugar. It's about your entire body's internal environment, the way your cells behave, and even the way cancer cells can take advantage of those conditions. So, if you or your loved one has diabetes or is at risk, this session is going to be an eye opener. We're here to connect the dots and show you what you can actually do starting today. So, here's something that doesn't get talked about enough. So, people with uncontrolled diabetes are more likely to develop cancer, like liver, pancreas, and breast and colon cancers. It's not just about the sugar feeding cancer. Chronic inflammation, hormonal imbalance, and an overworked immune system all play a vital role. So, yeah, medicines help, but lasting protection starts with repairing health at a cellular level. So, this is where PPARs come in. Master switches in your cells that turn off chronic inflammation, improve insulin response, and help your body heal, defend, and resist cancer promoting changes. So, does everyone or anyone here have a family history of both diabetes and cancer? Please feel free to put a heart or like or comment down in the comment section. Tonight, we are privileged to have two amazing experts with us because one of them will walk us through the science of cellular health in a way you've probably never heard before. And one of them will explain exactly how controlling your diabetes isn't just about avoiding complication. It's about preventing disease at the root level. So, if someone already has diabetes, how soon should they address the cancer connection? And can the damage be reversed or slowed down? Remember, controlling your diabetes isn't just about avoiding complication, okay? The best time is actually to start now. And that's why we share solutions like Simply Nature PPARS, which our experts have seen support metabolic health and immune defense. If you're ready to take charge, talk to us. Whether it's your first step after diagnosis or you're already on the journey, we'll guide you personally. The best time to take control was yesterday. The second best is today. Learn more about PPARS, get your personal health plan, and start your journey from start to healing. The intention of tonight's webinar is to make sure we answer more questions coming from all of you for us to be able to empower you more in your journeys. So without further ado, let's dive right in. Leading tonight's AMA or Ask Me Anything portion is our highly respected health experts. First up, it's an honor to introduce Dr. Jansen Calalan, a graduate of St. Luke's College of Medicine and diplomate of both the International Board of Lifestyle Medicine and the Philippine College of Lifestyle Medicine, currently serving as consultant at renowned institutions like Alta Integrative Medicine and Wellness Complex at Perpetual Health Medical Center, Las Piñas, Tree of Life Wellness Center, Centro Holistico, and Simply Healed Medical Group, where he practices integrative oncology. He is one of our health experts tonight, is a successful entrepreneur and seasoned international speaker who brings deep insight into personal health and success. He is the CEO and founding director of Simply Nature International and PPARS expert from Singapore, Mr. Shyan Lim. Good evening, Sir Shyan, and good evening, Dr. Jansen.
Good evening, Sheila. Good evening, Doc. Wow, it's actually a long day today. Uh, Doc, you look a little
Yes, indeed.
tired as well.
Yes, indeed.
Okay, we are all a little bit bushed, but we are happy to be on tonight at 7:35 right now. I think Singapore and Philippine time. Doc, I just want to start our discussion today. Talk about diabetes. Um, is diabetes still a big issue? Because is it it used to be, I think it still is, the top five killer in most first world countries, and I'm sure also even in third world countries. Uh, so how real is diabetes? How serious is it in general? And should people be worried about it?
Yes, no, the answer is yes. For diabetes, if you look into the top four or top five causes of death of Filipinos, diabetes is number four.
Wow.
Globally, uh, I think diabetes is also in the top 10. So that's around the world. I just don't know with Singapore, but I
Also
would
it's one of our
guess
top five.
top five, right? So diabetes is really a very problematic disease to have, and seeing that a lot of people are dying from it. The problem is, it's really burdensome. No, it's really burdensome because diabetes is not just a disease, or it's not just an end disease. Okay, it's also a risk factor to get other diseases. Okay, so usually with the thing with diabetes is you don't necessarily feel anything, but you have it already. Okay? So we can diagnose someone with diabetes even if the patient is still asymptomatic, or someone who's, doesn't feel anything at all. We can diagnose someone with diabetes in this case. So if you are someone who is not regularly going to you're not going for health checks regularly, you will miss this. You will miss this, and most of us misses this. Even healthcare professionals, sometimes we're too busy, working with patients, and we tend to forget ourselves. We tend to forget our own health as well, and we do get this diagnosed with diabetes as well. No, so it's a very problematic or burdensome disease to have. That's what I would like to point out. But it's a disease that if you have it, there's still hope in reversing it. It's not something that's it's not a hopeless case, like someone who has end stage renal disease, or someone who has stage 4 cancer, or these kinds of cases. So diabetes is still a condition. Even if you are on insulin, it's still a condition wherein, hey, there's a lot of room for improvement.
Yeah, Doc, I mean, just some statistics from Singapore. 1 in 10 adults is diabetic. All right.
I'm
And
not surprised.
yeah, and diabetes is the number, and Singapore's diabetes related kidney failure. So that means straight away dialysis is actually one of the highest rates in the world. Maybe that's why we raised a lot of funds for the Kidney Foundation for dialysis. Yeah. So Doc, number one, I think one thing is very interesting when talking to a lifestyle medicine doctor like yourself. When you were in med school, definitely the causes of diabetes that was taught in med school might be different from when you went into integrative medicine, right? So many people still believe and think that diabetes is caused by eating too much sugar. But I remember in our conversations, one of the primary causes for diabetes is not sugar, but actually fat.
Yeah.
So before we dive into that, maybe can you comment something about this? I think this is something people try to improve because they lower their sugar intake, but maybe they do keto or something like that, and there's a very
Yeah,
high
yeah.
fat intake. Yeah. Can you share
Yes.
some light?
Yeah. So diabetes. So let's just define diabetes first. So diabetes, especially type 2 diabetes, it is insulin resistant. So anybody can, chat GPT this, and that's what chat GPT will give you. It's basically insulin resistance. So what is insulin? Insulin is it's a protein that our pancreas produces to open up the glucose gates of our cells. So
Oh, okay.
our cells are closed. So it's a sphere. So the question is, glucose is the fuel of our body. Okay, how will cells into the glucose? How will glucose enter the cells? Okay, so there is a gate that must open,
Oh,
a
wow.
door
Okay.
that must open. Okay, so the key to that door is insulin. Okay, so when you eat, when someone feeds, so the person eats food, the food gets digested and broken down into the basic building blocks. No, so the basic building blocks would include your glucose, your amino acids, your fatty acids. Okay, so for glucose, when that enters your bloodstream, the body will sense, okay, um, Jansen is eating. Uh, I know Jansen is eating because his blood sugar just increased. So I cannot. I have to be able to utilize this sugar in the blood, the glucose in the blood. So I have to tell pancreas to produce insulin so that we can open the doors of the cells, no, to allow glucose to enter to be used as fuel. Okay, so that's how the basic biochemical reaction works. If we have insulin resistance, diabetes, then the insulin, the key is not working well. Or there will be less doors that would open up to insulin. Okay? So how does it happen? So first is if you are eating way too much sugar, okay, then there's not enough insulin that the pancreas can produce. Okay, so that's one. Another one, number two, is when you are not using enough of the sugar. So there will be more sugar that will be left in the blood. That's the second situation. Number three is when there is something that's gumming up the door, something that's blocking up the door. Okay, so that block is fats. It's intracellular fat, so it's
Very interesting.
yeah, it's basically fat inside the cells. So you have multiple different causes, no? So excess food intake, excess calories, number one. Number two would be a sedentary lifestyle. You're not using enough, or through aging, your metabolism slows down. So okay, that's a second factor. And number three, there's just too much fat in your body that the fat enters your cells. There's another situation is when the pancreas are failing already. The pancreas are exhausted. The cells that produces the insulin inside the pancreas are getting killed.
Wow.
Okay, so this is when type 1 diabetes comes in. So you have your immune system attacking the insulin-producing cells of the pancreas, so that there will be less insulin that's getting produced, or there is way too much inflammation in the patient's body. The pancreas can also be infiltrated with fat. If the pancreas gets infiltrated with fat, the pancreas will be inflamed and the insulin producing cells can get damaged. So it's again fat toxicity. So this is how diabetes can happen in a person. So note, diabetes or a high blood sugar is just a symptom. It's just a symptom of something, of an underlying issue,
Okay.
an underlying problem.
I think tonight, I'll speak it in a layman language because Doc was being medical again. So tonight, let me get it straight. We always think that diabetes is high blood sugar. There's a lot of sugar in my blood. But the real definition of diabetes and the damage it does is that the sugar is not able to enter your cells. That is actually the condition of diabetes. And because the sugar is not entering your cells, that's when, what's that called? That's when it's left outside your cells, and hence, when you test your blood, it has high sugar because the sugar is not being used. And that part has got to do with insulin sensitivity, because insulin opens the doors of your cells for the sugar to go in. And Doc, I think one thing that is really, really important is that many people who want to control or manage their diabetes watch their sugar intake. But what they should also be watching, equally important, is their fat intake. Because if you take fat, it can block the door for your sugar to go in. So Doc, this goes down, I'm just going to segue a little bit. This goes to keto diets, right? Keto diets are low carb, so you get no sugar. If you have no sugar, then there's no sugar to be excess to be tested in your blood because you're not taking any sugars. But they take a lot of fats. So does this mean that their doors to their cells are very likely not 100%, but very likely going to be blocked? And if they ever go back on a normal diet, their sugar is going to spike up like crazy.
Yes, yes. That's why the concept of glucose intolerance. It's also the ketogenic diet proponents are, yeah, it's a term coined by ketogenic diet proponents. Glucose intolerance. Because with little amounts of sugar, their blood sugar spikes. It just spikes. No, so they're basically diabetic. So it's glucose intolerance. So they're on a high fat diet. Then they maintain normal levels of blood sugar. But if you think about it, based on the definition of diabetes, they're diabetic.
Because they're clogged. They can't take in sugar.
Yes, because they have insulin resistance. Yeah.
And I think the danger of this is that the illusion is that their blood sugar is normal, so they think they're healthy. But it's because they're not even taking in sugars. They are metabolizing energy in a different way, right? That's how a ketone diet works. Okay. Doc, just one last thing before we go to our Ask Me Anything segment is like, what's the link between diabetes and cancer? I remember as early as 15 years ago, I think for pathologists, right, there is a definite confirmed link from metabolic syndromes to cancer. So basically, metabolic syndromes are a precursor to cancer. That was as early as 15 years ago. Basically, people said that if you have diabetes, you have high blood cholesterol, and you have all these metabolic syndromes, you are on your way to developing cancer. So maybe can you shed some light about that? Does diabetes really, how does that really contribute to a person developing cancer? Yeah.
Yeah, okay. Diabetes is also a risk factor for developing cancer. Now, what is the link? No, so diabetes does not directly causes cancer. Okay, it's different. The risk factors for you to develop diabetes are the same risk factors for you to develop cancer. So, what are the risk factors for one to develop diabetes? Sedentary lifestyle. You have a bad diet. If you are obese, if you have vices, no, like alcoholic beverage drinking, smoking, these things. So these are risk factors to develop diabetes, and these are also the same risk factors. If you look at, if you chat GPT this, no, these are also the same risk factors for you to develop cancer. And a person, the lifestyle choices of a person who's at risk for developing diabetes, they usually have their lifestyle choices are usually parallel to someone who has who is also at risk for developing cancer. Okay, yeah. So when you look into the lifestyle or the environmental factors, no, that leads to cancer, number one is diet. Number two would be smoking or tobacco use. Number three would be obesity. It's a mixture actually of obesity, the other vices, no, alcoholic beverage drinking. Another segment are infections, but infections is a small portion only. The majority is the diet. Okay, so this is the parallelism between the connection between diabetes and cancer. There's another one. Now, when you are already diagnosed with cancer, diabetes accelerates tumor growth. It makes cancer worse. Okay, why? Why is it so? Because of insulin. For a person who is diabetic, you have insulin resistance, right? So if you have insulin resistance, then the body will compensate for the resistance. So the brain will tell the pancreas, hey, you have to work harder to produce more insulin because we have more sugar coming in. Okay, so the pancreas will now produce more insulin, and insulin is a protein that makes things grow. So in medical terms, no, it is an anabolic hormone. So when we say that something is anabolic, it is it is a type of metabolism that builds things. Okay, that stores things, that builds things. Okay, and of course, if you have a tumor, then the insulin will help the tumor become bigger. Okay, that's why if you look into studies, no, different studies, actually you can chat GPT this. You don't even need the paid version, just the free version would be enough. You would be able to find out that cancer patients who are diabetic, they have a shorter overall survival. They also have a higher recurrence rate. It's because of this. Now, how were they able to find this out? They realized that diabetic patients who are injecting insulin, they have a higher risk of developing cancer. So that's why.
Wow. So
Okay.
that's something every person, our program always talks about cancer, so everybody should be aware. Now, before we go to AMA, I just want to say, if you're diabetic or suffer from metabolic syndromes, you can actually easily, we're very confident to be able to manage that with Simply Nature PPAR tablets. And if you have diabetes that is a bit more serious, soft gel capsules. In fact, Dr. Jansen has an amazing track record in helping people get off medication, maintenance meds. It's a combination of he'll slowly wean you off maintenance meds while rebuilding back your body's ability to be sensitive to insulin again. And he uses PPAR tablets and soft gel capsules for that. So for any of you who are diabetic, pre-diabetic, or even serious diabetic, good news for tonight is that there is a solution. This is proven, clinically proven also, and over the last 20 over years, we have had hundreds of thousands, maybe even millions of diabetic patients all over the world that has benefited from the PPAR protocols. In fact, as early as 30 years ago, people who have diabetes have already used this as a natural form of blood sugar management. And as early as about 15 years ago, we actually understood what happened. In our microalgae in PPARS, there's actually this thing called PPARS, which is what the name of the product, peroxisome proliferator activated receptors. And these actually help to trigger at the gene level your metabolic pathways. And one of the effects is that it makes your cells sensitive to insulin again. And that's the key definition of diabetes, as Dr. Jansen shared today. So for all the diabetic patients out there, whether it's pre-diabetic, mild diabetes, or very serious diabetes, we have an absolute solution. And if you're on medication right now, here's the good news. You can actually book a consult with Dr. Jansen, especially if you have serious diabetes. I would definitely advise you to have a quick consult with Dr. Jansen. Why? So that he can monitor as you manage your maintenance meds. So you do a step-by-step and you can wean yourself off maintenance meds over a period of time. I think everybody that's taking drugs nowadays would like to be more natural. So if that's you, then please drop a note and arrange for a consult with Dr. Jansen, or simply ask any of our healthcare specialists in our customer service. All right, Sheila, let's jump into our AMA.
I just quickly want to say I've learned so much with just the few minutes that we started off. And what I'm happy about, we've been talking about cancer for the past few weeks, and right now we are helping a lot of people to prevent cancer by managing the diabetes. So, well, for our first question tonight, coming from Ms. Faith Halandoon, what is the diet plan for high creatinine patients so I can take them together with my PPARS powder and tablets for better results later?
Doc?
Okay, for high creatinine, so I am going to assume that patient would be with CKD, chronic kidney disease, no? So remember, there are other issues, no? Other cases, other conditions that can lead to high creatinine, okay? But I'm going to only discuss CKD, chronic kidney disease, a reason why patient has high creatinine. So if you have CKD, then you should be on a plant-based diet, whole food plant-based diet. So by whole food plant-based diet, you cannot eat any animal food products at all. So all the food that you eat would be plant foods, processed. plant foods. It should be natural plant food. So imagine a salad. Okay, that's how it should look like. All right. So yeah, that's the diet plan to go.
Yeah. Plant-based and salad. There you go. Thank you. Thank you, Dr. Jansen. It's for next question coming from Ms. Connie Colio. I'm scheduled for city biopsy this Monday. I have already received my vials. Okay, thank you. Is it okay to take this while I'm admitted at the hospital? Or should I take this Friday, Saturday, then resume on Tuesday or Wednesday once I'm already discharged?
Oh, Doc, that's an
Yeah.
interesting question.
Okay. The only concern that we have would be bleeding risk. Just so we're saying, well, if you look into the properties of Simply Nature PPARS, Simply Nature PPARS has vitamin K, which can theoretically help with blood clotting. However, there's also an ingredient in Simply Nature PPARS that helps with thinning the blood. So, to answer your question, it should not affect your clotting factors at all, but to be on the safe side so that it doesn't interact with the things that doctors are giving you, better to take the Simply Nature PPARS liquid, the vials, once you're already discharged, and once the doctors have allowed you to eat normally again. Okay, so this is to help you recover from the biopsy.
Yeah, there's another question also, I don't know about Philippines because I've never had the displeasure or the unfortunate situation where I had to stay in a Philippine hospital. I've been into clinics and ER, but not actually stay overnight. So in Singapore, when you're staying in a hospital, I think it's they, especially in ICU, they wouldn't allow you to take anything from the outside, right? So doc, that might also be the case, but it's quite easy lang in Philippines to smuggle in supplements and take it when the nurse is not looking. But I think the official policy in hospitals is not to take any supplements or even drugs from outside the hospital's pharmacy. Okay, so just take note about that. Yeah. Okay. And we wish you well. Keep us updated once you finish your procedure and you're back on the PPARS liquid. Let us know how it helps you. I think energy level is going to be one, recovery is another. All right. Of course, for the primary reason why you took it. Yeah.
Right. Thank you. Oh, just before we go to our next question, I just want to greet our viewers tonight, coming from Ms. Eden Etorne, Joy Rosario, Melinda Seville, Marlene De Leon, Angeline Lamera, Shri Suarez, Ma'am Shirley Kalalan, hello po. You also have Miss Jeanette Ku from Child House Manila, Helen Kamunayan, and Edna Aveo. There you go. Thank you so much for watching us tonight. All right, should you have any questions, please drop it in the comment section. All right, for our next question, coming from Angela Nugit.
Yeah,
How
I think
to
this one
take-
is really good, Doc. I think this question is so good for you because of baby Jhen. Yeah.
Yeah, so the question is, how to take the powder extract for a 2-year-old liver cancer patient done with chemotherapy and surgery, but now lung cancer? What dosing is recommended?
Wow, that's really tough. 2 years old. Wow.
Yes. For 2-year-old, for PPARS powder, well, just looking into the case, I believe 2 scoops twice a day would be enough because 2 years old, right? I mean, yeah.
Very
2
small
scoops
size.
twice a day. For me, I think it would be enough. But I just don't know what is the dose that Simply Nature recommends for 2 years old. No? Because the tablets, we have something, we have standardized dosing for pediatrics for the tablets. But for powder, I'm not quite sure. But I would dose it at 2 scoops twice a day still.
Doc, I agree with you because number one, we usually don't administer powder for kids because kids usually don't need that kind of nutrition, right? I mean, for kids, wellness and general and good nutrition, it will always be the tablets. So the only infants and toddlers that actually take our powder extracts are always cancer patients. So Doc, your dosage, agree with you, that will be our answer from Simply Nature as well. Wow. So our prayers really go out to you, Angela, for the 2-year-old. That's a lot that the 2-year-old is undergoing. All right. So keep us updated also on how she's doing. Okay. Yeah. Yeah. Okay. Yes.
Johnson, just very curious about this case. Can the 2-year-old also take the liquid extract?
Yeah.
Would it be good for her
Mm,
also?
Interesting question. Simply Nature advises not to. It's in the box. It's not recommended for children, but I have used it for kids.
Yeah.
That child had diarrhea. Okay.
Mm.
So we were like giving the liquid at 1/3 of the vial, 3 ml at a time. And that 3 ml, we're giving it once every 3 days. Why is it so? Because I am trying to give enough nutrients for the child to recover faster. But yeah, take note of this side effect. So it's not recommended for everyone. So I think it's you have to still come see me, or at least go see your doctor, who is also a Simply Nature PPARS doctor, to know if the product can be used for your child. Okay, so yeah, so that's the thing. Okay, that's the thing. But technically speaking, if we follow the advice of Simply Nature, the answer is no. It now whether the use of the product can be given to a specific patient, that depends on the doctor. How much of a risk taker the doctor would be, and yeah, how the doctor sees the patient's condition as well. Okay.
Yeah, I mean, just to elaborate a little bit about what Dr. Jansen said, because as you know, right, uh, the nutrition for the liquid is not a superfood. It's actually a super extract, right? So there is under no it's unusual. Okay, for adults, we have all this stress at work. We've been eating 20, 10, 15, 20, 30, 40 years of junk food or bad lifestyle. As we are aging, our body's breaking down. We have high blood pressure, high blood cholesterol, diabetes. Even if we don't know it, that we already have it. So for all these reasons, there is reason for an adult to want to take liquid extract. All right, because of the healing properties in the liquid extract. But a toddler doesn't even have time. It's not even fully developed yet in terms of growth and everything. So that is why it was a product that we, as a company, never thought about giving to a healthy toddler. All right. So as Doc Johnson says, are there situations where we would give, yeah, cancer, right? Where you really, really want to activate the PPAR pathways that will help fight and manage cancer. So yeah, that's the answer as well. So
My heart aches for this condition.
Okay.
Well, Miss
But
Angela,
here's a good example, right? Sheila, you can speak from experience actually. So Sheila's son was only 4 years old, or was he 5 at that
he
time?
was four. He was four when he got diagnosed.
Yeah, he got diagnosed with fourth stage nose cancer, and he was having pipa powder every day for the next 5 years or 4 years?
When he was still in the treatment, he was on liquid, and then after that,
Oh, sorry,
obviously-
liquid. Yeah.
Yeah,
So sorry. That's a good example. Sheila's son, Dominic, was actually on liquid, and he was 4 years old. And the reason is because he had fourth stage nose cancer.
yes, yes.
Right? And today, Dominic is healthy and top of his class. Sorry, second in his standard, which is pretty much still top of his class. All right.
Yeah,
Yeah.
I was actually about to say, if you wish to have a consult with Dr. Jansen, for you to be guided very well, then Miss Angela, please go for a consult.
Yep.
We'll definitely get in touch with you later or today. All right, for our next question, quite interesting as well, coming from Miss Curly. Is it normal to feel always sleepy when taking PPARS, even the tablets?
Oh, okay. I'm gonna answer this one. Okay. Take more tablets. Okay, I'm gonna tell you, take more tablets. Okay, the reason why. Okay, if you're feeling sleepy, or let's say you're feeling hungry, then I tell you, take more tablets. Okay, so one of the good things about whole plant-based whole foods like Simply Nature PPAR tablets is this. It's very nutrient rich. Okay. So when you're nutrient rich, it is very most people have been eating empty calorie or empty nutrient diets. You know, the food that you eat every day is actually not giving you the appropriate amount of nutrients. So one of the key effects is that your body will suddenly hunger for more of the nutrients that suddenly went into the system. So this will be signals to your brain as hunger, right? That's why many people who take Simply Nature to lose weight, tell me in a slightly frustrated voice, but I'm getting hungrier. It's supposed to help me lose weight, not put on weight. I'm hungry every time I take tablets. So my answer is take more tablets, right? You are probably deficient in a particular nutrient. And I'm talking about general nutrition. I'm not talking about specific PPARs. So that's why when you take the PPAR tablets, you're actually getting these nutrients. Your body's going to feel hungry for it, so take it. So I would actually up the dosage to 30, 40 tablets. And it will only last like 3 or 4 days. After that, all the hunger pangs will start to plateau off, right? That's because your deficiency starts to get covered. And here's your sleepy thing. I have a very interesting uh, actual occurrence. I have a friend who works for Accenture. His regular dosage is 10 cups of coffee a day. 10. Okay, so those of you who have worked in Accenture or you know what that company is, it's a consulting company, and he's actually an analyst. So they work like crazy, 20-hour days. They sleep at the client's office. That's how serious they are. So he is very overworked. When he started taking the tablets, he could not keep his eyes open. He was very upset because this affects his work. But his girlfriend was the one who bought him the tablet, so he continued to eat it. She insisted. Okay, so for 3 days, he could hardly keep awake. For 3 days, he could hardly keep awake. On the fourth day onwards, suddenly he became very alert, and he only needed 1 cup of coffee to go through his 20-hour days. Okay, so when I asked my mentor at that time what happened to this particular friend of mine, he was just sharing, and here I'll just like some input from Dr. Jansen, but my mentor at that time said, when there are many people who, for example, in Philippines, what's that called? Call center agents. They push their body really, really hard, right? You sleep in unusual hours, you work very long hours or very wrong hours. So your body's actually very, very tired. But you know what? You get used to it and you push through. That means your body's warning systems get switched off. It's like I always share this extreme example. If you break a dog's leg, it will scream and whimper. But unlike a human being, a dog will actually stop complaining maybe after an hour or so, and then they will limp on the leg and still wobble down the street. Why? Because I guess its pain receptors it switches it off. It has to go on, right? So things happen to many of us who work very busy lives like that. And when you take something like Simply Nature Pipa tablets that is so good in revitalizing the body, healing your body actually goes into healing mode and makes you sleepy. So my advice is to take more PPARs and really, or maybe on the coming weekend, take more PPARs and really, really sleep. All right, really, really give yourself a good rest. You should feel so much better after that. So I'm sharing that when you are feeling sleepy, that is actually a symptom. Yeah, that your body really needs rest. And many times clients trigger this rest response when they take PPAR tablets. Doc, yeah.
Yeah, I think that's a good good response. I mean, I have nothing to add.
Yeah, and of course, from a TCM, and of course, when you reach a certain age, feeling sleepy is definitely a deficiency. That means that there is definitely a deficiency somewhere in your nutrition, in your rest, in overworking, especially in TCM, they focus on body organs, right? So there is a deficiency, there's something overworked, you really, really need to rest. So one of the great things I used to tell people about PPARS, but I stopped because we kept focusing on cancer. So for cancer, people seldom have any of these symptoms because, yeah, I guess cancer is so serious, the body doesn't give those symptoms anymore. I always found that, Doc, very interesting. I always found that Simply Nature was almost like a diagnostic tool. A problem, if there is an early problem for a person when they take the extracts or the tablets, they generally start to show the symptoms. So if they actually have, let's say, allergies, and the allergies have and it's not allergy season, they take Simply Nature PPARS, and sometimes, yeah, they get runny nose and things like that. So I think it's like a Herxheimer reaction. So for this particular, for girly, my advice, double your dosage of tablets and then really take the weekend to rest. I look forward to you giving us feedback on Monday how you would feel after a really good rest over the weekend and double dosing on the tablets. Hopefully that will be enough for you to get recharged and get back to normal. All right.
Yeah, I've learned from Doc Jansen in one of our webinars that sleep is a big chunk of our health, and I've also learned from him that 25% of our lifetime is sleep. So get the best bed also, so you can enjoy it as much. Most especially,
We learned so
during
much from
the
Doc Jansen. We have to thank him.
Thank you,
We are
Doc.
learning by osmosis. Yeah.
Thank you, Doc. Thank you, sir. As for our next question coming from Miss Angel, quite interesting also. Question is, my sister is taking the powder extract and she's pooping 3 to 4 times a day. Is it normal or is this a side effect? Because she's not taking the cleansing plus or it's only the powder and the tablet.
We tackled this
Good
last
question.
week or 2 weeks ago, right? A similar question.
Different
I don't know,
person.
I forgot.
Yeah.
Well, okay, to answer the question, ask your sister if she's swallowing the powder.
Uh-huh.
Yeah. Because if you swallow that,
yeah, okay.
yeah, if you swallow that, I mean, the powder extract is not meant to be swallowed. So if you swallow that, I mean, yeah, it might cause, loose stools, diarrhea, because the tablets and the liquid can cause loose stools. I have encountered patients who have had, more softer stools when they take this. So that's one possibility. So ask your sister, are you swallowing the powder extract? It's not meant to be swallowed.
Yeah, it's meant to be put under the tongue. Okay. And then it slowly goes directly into your bloodstream. All right. So yeah. Okay. And
Yeah.
Doc, I know you mentioned before, so many patients actually have improved bowel movements, but 3 to 4 times a day is not improved bowel movements.
It's too many.
Yeah, it's some serious. It is detoxing. All right. So, okay, a few questions for your sister. All right. Number one, how does she feel? Okay, this is another important thing. After, you know, again, a simple example. Many times when you get food poisoning or something like that, when you go to when you have diarrhea, you feel better, or if you vomit, you feel better. All right. So the pooping 3 to 4 times a day is one thing, but how does she feel? Okay, if you are taking powder extract, you probably have some particular illness that that you want to deal with, right? So if it's cancer, are you also having chemotherapy? Are you having other treatments? Why? Because if going through if before this you had constipation and now you're able to go, your body's just cleansing. How long has it been going on? That's another important question. What's the color and the consistency of the stool? How much comes out every time? Okay, so I think 2 weeks ago we talked about this. If it's black in color, it's actually from a TCPM perspective, it's good news except in one condition, which actually is the same as Dr. Jansen, which is if it's blood in the stool. All right, if the black color is a result of dried blood. But if it's black color and it's not a result of dried blood, then from a TCM perspective, it's really fantastic because the toxins are coming out. Okay, so I would advise you have a consult with Dr. Jansen if this still persists for more than 4 or 5 days. Okay?
Right. Actually, sir, it was last week.
Yeah, we talked about
Someone.
stool thing.
Yeah, yeah.
Yeah, all right.
Okay, for our next, before we go to the next question, Doc Jansen, you have a fan in our YouTube, Melinda Hispano. He's saying good evening po. Hello po. He's watching from Muntinlupa City. Hello po. All right, for our next question, all right, from Ms. Cecilia Hayag Arellano, can PPARS help hyperthyroid with nodules?
Yeah, definitely. Especially the nodules. But the hyperthyroid, we have to control that with medications. And also have to find out if the hyperthyroidism and the nodules is caused by an autoimmune issue. Okay, so we have to address these things. No, so if this is so, then PPARS is just part and parcel of a protocol, of a treatment. Okay, so it's just a part. So the role of Simply Nature, the role Simply Nature PPARS will play is to help lower down inflammation. Okay, so and to help modulate the immune system. So that's the role of PPARS in the treatment of hyperthyroidism with thyroid nodules. If that disease is caused by an autoimmune factor. Okay, so for this, the answer is yes, it can help, but it has to be given in the right context.
I wanted to tell this particular viewer, right? Here's the good news. The good news is yes, it can help. Second thing is please schedule a consult with Dr. Jansen. Even I would prefer clients with hyperthyroidism to have the observation of a doctor, okay? Because I've had experiences where hyperthyroidism, they can have, for their Alzheimer reaction, which is their healing process, they can have fevers and things like that. And and I'm not sure what's your living condition and things like that. So I think for hyperthyroidism, the recovery process can be not so pleasant. All right. So I would definitely feel more comfortable if you have a doctor who is watching over you throughout the process. But the good news is the answer is yes. Right. It's gonna be able to help you. Okay. Yeah.
Thank you,
Have a
sir.
consult with Dr. Jansen.
Yes, I was about to say, for those of you who wish to have a consult with Dr. Jansen, simply type in how to consult. Our caring healthcare specialist, Ms. Beth and Ms. Iris, will definitely get in touch.
I guess for this viewer, this is the best answer, right? I think she wanted to know. She's looking for a solution for her thing, and then we're very confident to say yes, it can help. Right? So now the proper way to do it is not to self-medicate, okay? Because hyperthyroidism needs to, you don't just drop your drugs. You need to monitor your situation. So the answer is good news. Yes, have a consult with Dr. Jansen. You're gonna get well. Okay, bye.
Yes, we will always echo out that we want our patients well coordinated with your doctors. We have Dr. Jansen here to help. Okay. For our next question, coming from Ms. Fe Tolentino, is it also good with the patient with DCIS done with mastectomy?
A good question. DCIS stands for ductal carcinoma in situ. So what the hell does that mean? So ductal carcinoma in situ, we find this in breast cancer patients, no? So ductal carcinoma, so ducts, you have ducts, that's the key word there. So the breast consists of fat, ducts, and globules. So globules that produces milk. So you have your lobules, no? Milk producing lobules, and you have the ducts that leads to the nipple. Ductal carcinoma is cancer that forms along the milk ducts of the breast. Okay? The word in situ means that the cancer has not yet broken its shell. Cancer cells do form shells. Okay? That's what it means. So DCIS means stage 0 breast cancer. Okay? Now, the patient has finished mastectomy. So the next step that I will do here is to assess the patient. Okay? Because currently the patient has has good surgical procedure. So since this is stage 0, uh, the patient has done mastectomy. So the prognosis is really quite good for this, and the recurrence risk is very, very low for this kind of procedure. So the next thing that I would have to look into the patient is the appropriateness of the supplements or the products to use. So one thing that I will look into would be inflammation, because Simply Nature PPARS addresses inflammation really very well. Okay? Are there any metabolic factors, risk factors as well? So sugar, lipid profile, fatty liver disease, so these things. So if there are some things, some of these things that are, present in a patient, then I would consider using Simply Nature PPARS. Okay? So, however, if the question is, what do I do next? I was diagnosed with DCIS, ductal carcinoma in situ, so I have breast cancer, stage 0. And I'm finished with mastectomy. I am really worried that the cancer might recur. What do I do next? The next step would be to check if there are circulating tumor cells around your body. I would not request for a PET-CT scan just yet, because this is DCIS, ductal carcinoma in situ. The cancer has not yet broken out of its shell. Now, the next thing that I would request for is a liquid biopsy. Look into the circulating tumor cells, because if this shell have been broken out, no, one way or another, it has been broken out, then there would be circulating tumor cells present in the blood. Then if it is present, then I have to treat you as a patient who still have an active cancer. So it's a different protocol altogether. That situation does not warrant chemotherapy automatically, because the stage is 0. Okay. Technically speaking, if you did not talk to me, or you are simply with an oncologist, then the onco would just simply request for a PET-CT scan 6 months later. Okay, but this is the answer to the question only. So I have to speak to you to make a proper recommendation. Okay, so that's what would happen next.
I think this is why our program is so good, and why patients viewers like to watch our program. You are basically getting a very clear direction from Dr. Jansen. And for the rest of us, if you're a bit lost, because Dr. Jansen is really giving a very clear option for patients with very specific issues. Again, I just want to remind everyone, so that Dr. Jansen doesn't have to, that this is not a consult. This is an education program. So do not use our advice here as a consultation. Okay, why? There's too many information you have not shared. There are many more questions we have to ask to really give you a proper medical advice. So all this is what we're doing is education. So if it's not an advice, then why the education? What's the point? Because with this education, you know what to ask, and you know which direction to go for, and you can start to plan out what descartes, what strategies you can take, and what approaches you want to take with your fight against your particular illness. Okay, but remember, you got to actually go for a proper consult if you want a consult. Okay, yeah.
Excellent. Thank you, Dr. Jansen. Thank you, Sir Shyan. Okay, another question coming from Ms. Pe again. So how about when taking hormonal medicine like tamoxifen and want to start taking Simply Nature? Do I have to stop the hormonal medicine?
No.
You don't have to. You don't have to. You can take it in tandem together, but don't take them at the same time. So you can just space them properly. So I mean, an example would be taking tamoxifen in the morning, then taking PPARS at night. So that's how you space things out.
Yeah, and to add to that, our protocol is meant to help you fight cancer better, right? Dr. Jansen last week talked about, Doc, is it 14 now? Hallmarks of cancer? I remember last time. Okay.
14.
Yeah, it was 12 when you first introduced the topic to me. Now it's become 14. Okay, so there are 14 hallmarks gates or characteristics of cancer. Many of our treatments only focus on a few. So if you attack your cancer from multiple approaches, you're going to have a better shot and better chance. So combining your hormonal medicine like tamoxifen and Simply Nature PPARS, when you combine it properly, it's going to give you an even better fighting chance. So this is the time where I would also like to say, some people said, just take Simply Nature PPAR liquid extract for cancer. I would say no. I would say depending on your cancer, for many cancers, it would be go for your surgery, do your chemo, and take Simply Nature liquid PPARs. Then you will have the best results. All right. So there is no one magic bullet for cancer. Take all the bullets that work. Don't just shoot with the one bullet. There might be some bullets that are bigger or more effective, but it doesn't mean that if you add another protocol that is good and correct, you won't increase your chances. So fighting cancer is like if you do your surgery, you have 30%. Then you follow it up with chemotherapy, that 30% is going to become 50% with that. And you do it together with Simply Nature People Liquid, and that's just going to up the percentage again, right? So that's how we should take a look at cancer. So thank you for asking this, Tolentino, all right, because this is helpful for everyone. Yeah.
Yes, just like Doc Jansen said, the cause of your cancer is multifactorial. The solution should be also multifactorial.
Yeah, okay. Wow, you're quoting Doc Johnson now. He's quotable. Oh, Doc, I see this question. It's a question we've answered before, but I think it's always good to answer again. Lena asked, I don't want to go for biopsy because they say it helps spread cancer. Is this true? What happens if I don't go for biopsy? Yeah.
Well, it stays there. And we don't know what it is. That's the thing, no? Yes, it's true. If you biopsy, core needle biopsy to be specific, can cause the spread of cancer. But the risk only increases 2 months after the biopsy. So within 2 months, the treatment has to be started. Any kind of treatment has to be started to negate the increase in metastatic risk. Okay, so the benefit of biopsy is to gain knowledge what enemy we're fighting, what treatment would be appropriate for you. So in this regard, if you don't go for a biopsy, then there's nothing the doctors can do. Yeah. Okay. Now, if you are afraid of going for a biopsy directly, there are ways on how we can mitigate or what's the right English term, to evade it or go around it. Okay, but it requires a huge amount of financial capacity. So we can entirely rely on liquid biopsy. So I'm going to discuss liquid biopsy here. There is a procedure wherein we can get your blood, isolate the circulating tumor cells, assuming that clinically it really looks like that you have cancer. No, that's assuming that that thing first, no, that issue first. Now, if so, then we can perform a liquid biopsy to determine what kind of cancer you have. Okay, so how they will analyze it would be based on the genetic or the gene expression of the cancer cells, of the circulating tumor cells that we can get from you. So that those gene expressions would be referenced on the international database of genetic expressions for cancer. So there's such a thing. Okay, so if the gene expression matches that, if the cancer, your cancer cells gene expression matches that, matches the gene expression of the reference values, then that would be most likely the type of cancer that you might have. Okay, and another information that we can get from liquid biopsy is what medications, what drugs and natural extracts can be used against the cancer, or what drugs and natural extracts can be used to kill the cancer. So it's like getting your blood, isolating the cancer cells, and growing the cancer cells on the petri dish, and testing each and every drug available in the market and natural extracts, no, against the cancer, and taking a look at which drugs and natural extracts will kill the cancer cells, and then we choose the most effective ones. So we can do this. We can do this already. However, I still don't recommend going down this path because the data that we get from this is highly dependent on the biopsy, the biopsy that surgeons perform, because that is a pathologic diagnosis. In other words, we would be able to see under a microscope what it is, what really it is. Okay? Because sometimes, so in rare cases, even if a tumor grows in a specific part of the body, so say for example the breast, if you have a tumor on the breast, then automatic it's breast cancer. I can say that this happens only 99% of the time. The 1% are rare cases wherein we have a sarcoma. Technically speaking, it is not breast cancer. It's one of the tissues found in the breast, no, that is not part of the organ of the breast that turns into cancer. It's just so happened that it is located near the breast. So I hope you got what I meant. So I'll give another example. So the breast has fats, it has lobules and ducts. Behind the breast would be your muscles. Okay? If a muscle located just behind the breast becomes cancer, then technically speaking, that's not breast cancer. It just so happened that it is located near the breast. That's why you have a lump on the breast. Okay? So, but technically speaking, this is not breast cancer. So when the only way for us to find this out is through a sample collection. So biopsy is still warranted. Okay? Biopsy is still warranted to determine properly appropriate treatment for the patient.
So, for this particular viewer, you're afraid of biopsy, but if you don't do the biopsy, your uncles won't know what to do next. Okay? Because many times we say here, for example, chemotherapy. There are many, many different types of chemotherapy drugs. And because chemotherapy drugs have very serious side effects, your uncle is not going to guess which one to give you. He won't be able to, in good conscience, prescribe you anything because he may be prescribing the wrong drug for you. Okay, or a drug that's not that effective for your type of cancer. So even in breast cancers, there are many different types of breast cancers, and they all have different types of drug protocols. So the biopsy is for the doctor to decide how to treat you. Okay, so it is a necessary process. Now, Dr. Jansen has also clearly said that a biopsy does have its risk. All right, so your question about is it true? Yes, it's true, but not the same way you understand it. I think many viewers who ask this question think that if you do a biopsy, your cancer will spread. It's not like that. All right. Even if you don't do a biopsy, your cancer will also spread. All right. Have you ever thought about that? If you just wait and do nothing, your cancer is going to spread also. Okay. So what you don't want to do is do a biopsy and then do nothing. All right. You want to do a biopsy and then straight away look at the strategies that your biopsy report gives you, and then don't delay, then start on your treatment. Okay. If you're going to go for conventional treatment, I really suggest you have a consult with Dr. Jansen to be able to support you integratively with your chemotherapy or whatever oncological protocols or even surgery. Okay. So that's what you want to do. Go for your biopsy, because if you don't do anything and wait and guess, if that tumor really is a cancer, it's going to spread also. So having biopsy is not the only way a cancer spreads, right? Doing nothing or guessing is also another way your cancer will spread. So the biopsy at least gives you very clear strategy. And as Dr. Jansen said, for the first 2 months, if you act quickly, then the risk of the biopsy causing any negative spreading is actually diminished, all right, or managed very well. Okay, yeah. So go for a biopsy and then don't sit on it. Quickly make decisions and move forward with your treatment.
Thank you. Thank you, Sir Fang. Thank you, Dr. Jansen. Another interesting question coming from Mr. Ed Cervaros. Hi, Doc. What determines staging of cancer?
Good question. Okay,
Question.
staging. Yeah. So when we talk about staging, we are finding or categorizing how far the cancer has spread. So usually we use 4 stages. So stage 1 is where we see a visible tumor, but it hasn't gone out of the region yet, or it hasn't affected nearby organs yet. So if we are talking about stage 2, then lymph nodes would be affected already. Okay, lymph nodes. Now for stage 3, it would still be lymph nodes, but there would be specific sizes of the tumor as well. So sometimes we stage the patient if the tumor has crossed the 2 centimeter mark, or the 4 centimeter mark, or the 5 centimeter mark. So it really depends on what organ. Also, if it has affected lymph nodes that are not directly connected to the main tumor, so that can be stage 3. Okay, when we talk about stage 4, then distant organs, no, away from the organ at issue, are affected already. We've seen metastasis already. So one example would be breast cancer getting bone metastasis, breast cancer getting brain metastasis, or colon cancer getting liver metastasis. So that's stage 4 already. Okay, so that's how we at least classify the staging of a patient. Now, what tools do we use to stage a patient? Of course, that would be imaging studies and the biopsy, the histopathologic biopsy of a patient. So that's also part and parcel of staging the patient properly. Okay, so that's how.
For myself, I using a non-doctor's approach, but patient's approach to understanding staging. I'll break it down into 2 parts. Number 1, if it's stage 1, stage 2, you're gonna have beating cancer is like I won't say a sure thing, but your odds of beating cancer are so good. All right, just go through your protocols, you're gonna be fine. Okay, I think that would be a safe attitude to take, that you don't have to be super worried about that. That yes, it is a serious illness. Yes, it is a life-threatening illness, but you are in a good position if it's stage 1, stage 2, right? Stage 3, stage 4 means it's serious, and you gotta act fast. Time is not on your side. You gotta be very serious. Not that you're not serious in stage 1, stage 2, but this is very critical. Things have to move fast, all right, for stage 3 and 4. And the other simple definition is stage 1 and 2, the cancer is still in its original place, more or less, right? But once it's stage 3 and 4, it has spread to other areas, and for stage 4, it has spread to other parts of your body, and it can be very far away from the original location of the cancer. But that is also what makes it so dangerous. Right now, it's so hard to treat because the cancer has spread. Yeah, so I think, yeah, that will also be a layman way of understanding. Stage 1, stage 2, can breathe, okay, can go to the oncologist confident that you're gonna be fine. Stage 3 and 4, okay, it's serious, and you got to be very, 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 very mindful, very, very disciplined. Yeah, do whatever it takes. Attitude really for stage 3 and 4. Yeah.
I just realized, including Dr. Jansen and all our other doctors who are in our journey of cancer, those doctors who are kind of in a rush for us to start off the medication and treatment are actually the ones, who are truly concerned with sincerity that you have to start the treatment already. Otherwise, it can progress. So
Yeah.
there you go. Thank you. Thank you, Dr. Johnson. Thank you, Sir
I
Shyan.
know it was very helpful when Dr. Johnson actually did a seminar on a program on the the statistics of survival for different types of cancer. So I just remember like for the worst type of cancer, I think pancreatic cancer, liver cancer, these are very difficult cancers to treat, right? Success rate at stage 1, stage 2 is like 70%, maybe even high 70%. Already is not so high. You wouldn't want to go and bet your life on a 76% chance of survival only, right? That means you have 25-30% chance that you won't make it, right? But these drop to almost very low double digits, like 14% when they become stage 4. This is how serious it is, right? And breast cancer is actually like 90 something percent, if I'm not wrong, doc. So it's almost like you're gonna be fine. But if you allow it to go to stage 4, it drops to like below 50%. And then it's the big difference between almost a sure win at 90 over percent to become 40 something percent. That's like wow, it's like flipping a coin, right? That's so scary. So don't wait. Don't allow your cancer to progress to the next stage. All right. Yeah. Take action quickly and strong. All right. And be very resolute about it. Yeah.
Very well said. Thank you. Thank you, Sir Sean. Thank you, Dr. Jansen. Okay, let's try to answer at least two more questions. Next question coming from Ms. Joy Rosario. Good evening, Doc. I just had my total hysterectomy due to endometrioid carcinoma stage 1. My biopsy turned out to be good since the cancer did not go out from the uterus. My OB oncologist recommended me for radiation therapy. What is the best Simply Nature products that is good for me while ongoing radiation therapy? By the way, I also have type 2 diabetes. Thank you so much.
Yeah, for this kind of case, I would recommend the soft gel. So we're just trying to mitigate the side effects, then or trying to recover faster, then soft gels would be enough. There are a lot of Simply Nature PPAR doctors that I know of who are also prescribing soft gels, no, for to help manage the side effects. All right. So, but of course, no, again, I have to know more details with your case so I can make the best recommendation. But just to answer your question, yeah, soft gels would probably be my first go-to. Then, if it's not soft gel, then other information might be, might influence the decision. Yeah.
Yep.
Sean?
Nothing to add. I think just as a reference, many of our doctors, many of our oncologists, right, and oncological surgeons, they use soft gel as the standard, going into, for example, chemotherapy, radiation therapy, right? However, the moment the patient doesn't react well to the radiation therapy or chemotherapy, then they up it to. Usually they jump straight to the liquid after that because they want the patient to recover quickly. And then once the patient stabilize, they they will try soft gel again. And then if it's okay, then just soft gel, and they keep the rest of the liquid that they bought in case in later treatments the patient might be weak or something, right? So yeah, so exactly as Dr. It's just that if if the situation becomes suddenly worse because the patient is reacted poorly to the chemotherapy or radiation therapy, then just be prepared to move to the more higher concentrated powder and liquid. Yeah, and most of the time, because if the reaction was not good to the radiation or chemotherapy, and when I say not good, I don't mean that the radiation therapy doesn't work. All right, I meant that the patient was also weakened severely by it. And for chemotherapy, sometimes patients would have an adverse reaction to the drug. Then they really need to recover as quickly as possible. So since in these situations, speed is important, very often the patient will go on to the liquid so that they can recover as quickly and as strongly as possible.
And do consider AD Pro as well since you're going for radiation therapy.
Yeah, that's true. AD Pro will be one of the best things. I was talking to Dr. Jimmy. He was just sharing that, for radiation therapy, really the only thing the doctors can give advice for is moisturizers and aloe vera, which also works largely for as a moisturizing effect. However, AD Pro actually, because radiation definitely kills all the microbiome on your skin, so AD Pro quickly repopulates that with healthy bacteria that will protect your wounded skin, and then help you heal. All right, so AD Pro is a great combination for anybody for going for radiation therapy.
Exactly. Thank you, Sir Shyan. All right, well, it looks like we've covered all our questions for tonight. So,
Wow. Okay.
yeah,
I'm
so
actually tired.
yeah, but well, we're almost at the end of the webinar. As we wrap up this evening, I'd like to ask for a very quick parting words from the both of you. Dr. Jansen,
Yeah,
would you
I'll go
like to-
ahead. I'll go ahead.
Okay.
Yeah, so a lot of questions, interesting, no? A lot
Yes,
of
yes.
you are trying to, ask advice for your cases. Now, please don't take our answers, this discussion as a consultation or something that you have to take action on, okay? Because there are a lot of information that was not taken into consideration that I did not know of. No, so please take this webinar only for educational purposes. All right. Now, if you really, really need help, I advise you to go see your doctor, any simulator doctor that's near you, or you can schedule a consult with me so I can make a better recommendation. Okay. So I just want to share that there's I already had an experience when a viewer took action with what I said in this program, and the advice was wrong. Okay, so please do not. Please be careful. Okay, take everything that I have said with a grain of salt. Okay, because we haven't had a proper consultation done. Okay, so please be careful. All right. So
Wow.
this would be my parting word. All right. So for the Simply Nature team, this goes to show that we are really making a very big impact
Yes.
on the lives of people. Okay, and yeah, I hope you guys get inspired with this, and our patients, please be careful. Be very, very careful. Okay, we're doing this only for educational purposes, and this does not consist, or this does not this is not a consultation.
Yeah.
Okay, so to do a proper consultation, please schedule one. Yeah, the longer you wait, then the longer that I would be able to see you. Okay. So because my schedule next week is actually let me see, it's 70% full already. So please schedule the consults. All right, so if you really, really need my advice, right? So I'll give the floor to Sir Shan.
Wait, number one, I just want to say this is why we respect Dr. Johnson and we appreciate him so much. I mean, tell me how many celebrity doctors will actually go live on viewed by thousands to say that already there was someone who misunderstood the advice, and it did not fit well with that patient's condition. All right, so we really got to give Dr. Johnson, I guess, recognition for his integrity and how it speaks of his sincerity in doing this program and how clear we are about how serious we are about what we're doing. Okay, so yes, because and I guess my last word will be why can't this program be taken as consultation? Okay, I'm going to share some insights with you. Okay, because many times the viewer only presents to us the information so that he will hear the answer he wants. All right. So, for example, you may say that, do you really need to take drugs for your diabetes because it's only it comes and goes, but you didn't say, all right, that you really, really like to eat lots and lots of lechon and cake, and you just you get what I'm saying? It is very easy for patients to come to us and only present the side of the information so that we will give the advice that they want to hear. And then and it and it becomes a validation. It's like, okay, if the program experts say this, then I must be on the right track. No, you're not, because you only gave us information that will lead to the answer that you want. Okay, and that's not going to be helpful to you, and it's not going to be helpful to all the viewers also. All right, so that's why it is so important for everybody to understand this is not a consultation. But then where is the value? As Dr. Jansen said, to the whole team, we're having a really, really great impact. Okay. So we're not discouraged by scenarios that Dr. Johnson just pointed out. In fact, it just makes us understand what we do is important. We give enough information for patients to then ask questions. All right. It's just that sometimes patients ask wrong questions. But I think it's always important to be able to understand where you're going and have an idea what is the strategy you're approaching. Okay, but always be willing to learn, always be willing to see things from different angles. Okay, and again, go for a consult where the information will be more complete and it's an actual consult, and you can then take it as medical consultation. All right, and not education. So, Sheila, are we still having a program next week, or is it a public holiday?
It is so far.
Okay.
It is still a public holiday, but we'll play by ear if there will be any changes. But we'll definitely put an announcement on our social media, because I'm sure that a lot of you might be waiting on our next Thursday.
All right. Okay. I'll hand the time back to Sheila. I'm signing off from Singapore. So wishing all of you a great weekend ahead, and good night.
Thank you, Sir John. Thank you, Dr. Jansen. All right. Well, thank you so much for all your questions that you've thrown to us tonight. And thank you, of course, for considering our program of value while we journey with you on our own health battles. So on behalf of our patients, once again, thank you so much, Sir Shyan and Dr. Jansen Kalalan, for putting so much effort, sincerity, and honesty, integrity towards your answers for all of us today. Thank you so much. Now, I just some few announcements. Because you asked for it, it's back with another round of 1-day free shipping on all orders with a minimum cost of 3,700 or more. And it is only happening via website. So you have to order via website, which is www.simplynature.ph. So this is an exclusive deal for tomorrow only, August 15. Okay, so from morning up until midnight. So please don't miss that out. Now, now is and more than ever, strengthen your family's immune system. Simply Nature PPARS can help your body stay resilient in stressful times. And choosing health is never selfish. It's a gift to your loved ones. So don't wait. Contact your client service officer and start your wellness journey today. So it could be me, Ciela, Ms Janelle, Ms Karen, and Ms Daisy Rose. Okay, so once again, thank you so much for spending your time with us. We hope to see you on our next webinars to come. That is happening probably August 21, but we'll play by ear as I've mentioned. But it's going to be another Thursday, 7:30 as well, here in our Facebook, and also simultaneously playing in our YouTube channel. Now, once again, this is Simply Healed webinar powered by Simply Healed Medical Group and Simply Nature International, distributor of Simply Nature PPARS. Your curiosity about your health conditions and your victories over cancer and metabolic diseases are what keeps us going. Because here in Simply Nature, we're always with you from start to healing. Thank you, everybody. Good night, and God bless you all.